Dr. Maja Edgar from Edgar Family Chiropractic, and today I would like to speak to those of you who have experienced back pain, whether it's you're experiencing it currently, maybe a new episode, or if you've had back pain in the past and it continues to be a chronic issue for you. What I've hoped to do in this video is to tell you what is actually happening in your body and what actually helps. So in as clear and honest way, I'm going to try to explain what back pain is, why it keeps coming back, and how we can approach treatment, and how we approach treatment here in our Burlington clinic. So the first thing to understand when it comes to back pain is that the back is a system. It is comprised of the cervical spine, which is your neck, your thoracic spine, which is your mid-back, your lumbar spine, which is your low back, and within these areas of the spine, we have facet joints, which are the little joints where that help us move. We have muscles, we have ligaments that are stabilizing everything, we have nerves, we have discs that are shock absorbers. So it's a complex system, and if this system gets overloaded or irritated, this leads to dysfunctions, and our body's way of telling us that something is wrong is that it gives us a pain signal. I do want to address one myth that we often hear here in the clinic, and that's this idea of bone out of place myth. So sometimes patients come in and they say to me, I feel like I'm out, and could you please make sure that I'm aligned? And what I would say to that is that it's a very simplified way of looking at things, because our back is a very stable system. So to be out is impossible. There are lots of muscles and ligaments that contain our joints and our discs. So it's not that you're out, it's just that somewhere along the line, whether it's the joints, the muscles, or the ligaments, something is dysfunctional, something is not working to optimally move you, and this is causing discomfort and irritation and pain. And we need to figure out what that is, and then we can treat it appropriately. So back pain most often comes from a muscle strain, a joint irritation, a disc irritation, or sometimes just improper movements or habits over a long period of time. And the good news is that it responds well to the right kind of care. We just have to figure out the root cause of it, and then we can figure out what the right approach to treatment is. So why does pain sometimes persist? And the reason why it persists, and the reason why we see this sometimes, is that usually the everyday lifestyle factors can often lead to a cycle of pain. So what do I mean by cycle of pain? The cycle of pain starts when some load beyond what the spine can handle is applied to the spine or to some of the bones and ligaments and joints. So this could be long hours at a desk, this could be heavy lifting, maybe a very heavy lift, just one, or it could be heavy lifting over a long period of time, let's say for a job that is very physical. It could be a long drive, a long airplane ride. It could be just not enough movement. So something that, people such as who work at their desk for 8 to 10 hours. It could be something like stress or poor sleep. And so our tissues, such as the spine and the joints and the ligaments and the muscles, they all have loading capacities. And what that means is that they can only handle a certain amount of stress before they start to break down. And if we apply some load that is beyond the threshold of what those tissues can handle, we get dysfunction. So sometimes micro tearing or a collapse in that tissue, which then leads to pain, because that is our body's way of telling us to do something about the injury that's happened. And what then happens is usually people go into rest mode. They don't want to move, so they just stop moving, sometimes completely. Then when the pain decreases, if they don't do anything about their tissues that have just been injured, they go back to their life where they're maybe having long drives, or maybe they are lifting repetitively, or maybe not doing enough to help strengthen these tissues. And then the same process will happen. Those tissues that are now that were weak to begin with and now, potentially got weaker because of the injury, you apply a load to them, and that threshold of what the tissue can handle is even less, and then the whole cycle repeats itself. So the body is basically not strong enough to keep up with the life demands. This is what we see a lot. If we can make the body a little bit stronger, its ability to carry the load of daily life will increase, and therefore it won't take so little to cause injury. Chronic or persistent pain usually means that an area is weak or deconditioned. Sometimes it can become sensitized if there are injuries that happen to it over and over. It's chronically affected, and it gets stuck in a pattern that needs to be broken. So before we get to the treatment, I want to talk a little bit about the assessment process here in the clinic. When somebody comes in with low back pain, usually the first thing that we do is a very thorough history. We talk about when did this happen, how did it happen, what makes things better or worse, is sleep affected, is work affected, is life affected with your children or at work or with your sports activities. That already gives us an idea of what the patient is feeling, what might be going on, and also gives us an idea of their goals. Then we get into a very detailed physical assessment where we look at posture, we look at movement patterns, we do ranges of motion where we're checking to see how well you're moving, because finding out the root cause is what's going to help us come up with a better treatment plan. The one thing that I will mention is that we will often look for red flags. And these are things such as changes in bowel or bladder, numbness in the saddle area, weakness, progressing weakness in the arms or the legs, unexplained weight loss, just to name a few. And as primary care providers, it's our duty to rule out the red flags and to make sure that you are in the right place. If we feel that there are red flags present, we may be sending you either to the hospital or back to your doctor for further investigation. When it comes to treatment, typically care will focus on 4 phases. And phase 1 is usually calming things down. So we are trying to calm down the irritation. We are trying to improve movement. We are giving you strategies for sleep, daily movement, so we're not re-aggravating the area. Often this phase focuses on reducing inflammation. If there's a sprain or a strain, we're trying to reduce, the body responds to that usually with some irritation, so we're trying to reduce that irritation or that inflammation with certain modalities like ultrasound or electrical stimulation. We are doing gentle muscle work to improve circulation so that inflammation is flushed out as quickly as possible, giving you things to do at home so that you can continue that as well. Phase 2 usually focuses on restoring motion. So here we're working with mobility. We're trying to get back mobility through the spine, to the hips, to the pelvis, whatever area is affected, through chiropractic care, muscle therapy, spinal mobilization, trying to get the joints to move a little bit better. And this usually will help with morning stiffness, will help with those tight upper backs, sometimes between the shoulder blades that people complain about. And all that starts to improve during this phase. The third phase is the rebuild phase. This phase is really, really important because the body needs, as we said initially, it needs better strength, it needs better endurance, coordination in order to stay out of pain and break that cycle of pain that we spoke about. So pain relief is only part of the solution. If we focus on just reducing pain and not strengthening the tissues, then we're likely to fall back into that cycle of pain. So this is where we are giving exercises, we are making sure to give you some tools to do things at home so that this doesn't come back. And phase 4 is sort of the final phase where you're back to regular life, back to work, back to exercise, sports, whether it's lifting or playing with your kids, hiking on the weekends. We're talking about lifting mechanics, sport and maintenance to avoid any sort of setbacks. And the rebuild of back to regular life often includes things like showing you how to strengthen your core, how to strengthen your glutes, how to build postural endurance so that your upper back feels a little bit stronger, especially for those people who work at a desk. When it comes to treatment here at Edgar Family Chiropractic, we often will also add certain therapies if we deem that it's necessary. And I want to just touch base on those additional therapies such as medical acupuncture. We tend to use it for certain presentations such as chronic pain conditions, nerve pain, stubborn muscles, and very chronic things that are not getting better. And medical acupuncture essentially just involves the insertion of very, very thin needles into areas that are affected. This in itself improves circulation to the area, and then what we do is we add a little bit of electrostimulation to those needles to retrain the muscles and get them to work a little bit better. We use other physiotherapy modalities such as interferential current, TENS, ultrasound, ice, heat, whatever is necessary. Rehabilitation exercises, of course, are a huge part of what we do. And the main thing with our treatments is that each one is very unique, and each treatment is sort of tailored to the needs of our patients. So for example, 42-year-old patient recently came in with 3 months worth of low back pain. She has a desk job, likes to do yard work on weekends, and she was having some short pain in the low back with bending forwards. So the pain was rated a 6 out of 10. She was having morning stiffness and could not sit for longer than 30 minutes. So with her, we worked on education. On education on how to not hurt herself further, gentle mobilizations. We did a lot of muscle therapy. And by week 2, what we saw was that the pain was already at a 4 out of 10. She was sitting for longer periods of time, and we were giving her some advice on movement breaks when she had to sit for work. By week 4, we were already getting to core and glute exercises, and she was getting back into her usual exercise routine. And by week 6 to 8, she had lots of confidence with lifting, moving, and just maintaining things at home. So the goal is not just to decrease pain, but figure out how to function better, how to have a body that keeps up with our life demands and does not keep getting injured. So if the back pain that you're experiencing is slowing you down, we would love to help. Look at back assessment, pain assessment at Edgar Chiropractic in Burlington. We serve patients from Burlington, Hamilton, Oakville, surrounding areas. Feel free also to download our free back pain relief guide, which covers common triggers, red flags to watch out for, gentle movement tips, and what to potentially ask at your first appointment. The link is below, and see you soon.